what do you know about Lord Darzi, and what can we expect from his investigation into the NHS?
Okay, I think that's the right question, because we do know a fair amount, and in a short answer, it's that Darzi helped shape the problems that we have today as part of both the last Labour government and the last Tory governments. He was active in as a policymaker in both. And I think that's really important for us on the left, and those of us who are supporting independent candidates and those who supported Corbyn, to be clear that the policies under the Tories included participation by prominent New Labourites at the top. We know, you've heard a bit about Simon Stevens. There were at least 6 of Tony Blair's own personal advisors running things from this really powerful quango, NHS England, that had more powers than a health secretary. So it's about continuity, and that's the really useful thing, is that we kind of know the picture. So we just need to look at it and make sure we're clear about that. So he helped shape today's so-called landscape of more hospital closures to extract the profitable bits. So all the massive ambulance queues that we have at the moment, the fake doctors, people going without healthcare, which increases both the number of people going private and opportunities for government contracts in thinned back services. And we can expect this to be an exercise in spin. And again, the spin itself is quite familiar. So that's really useful for us on the left, or those of us who care about the health service, that he will be diagnosing that we need more of those problems. I mean, he's done at least 2 other reviews, one in 2008, one in 2018, and it's the same stuff that gets regurgitated. And it's not just him, it's across the health policy sector, which is right-wing dominated, absolutely. I mean, there haven't been any left-wing governments that supported Bevan since Thatcher. They've all gone the opposite way. So they've built this culture, and it's theirs. That area belongs to them, sadly. And that's a big problem, because it's not democratic. We don't have a say, the public. So the spin, and it's so familiar, you will have heard it a million times, but it's not always identified as spin, because it poses as neutral, and it's basically leaves on the track excuses that cover the corporate drive to reshape services for corporate benefit. And so, for example, Darzi in 2018, but it could have been almost anyone, who was saying the factors that have exerted such pressure on our health and care system over the last 10 years, changing demographics, that's people getting old, the rise of chronic disease, growing patient expectations, the onward march of science and technology on the march. This is the picture that they're painting. And when we know for a fact that the 2012 Act, the 2022 Act, the policies that went on before that, they were all corporate influenced. And this picture paints something in which everything is just an act of God. And so you have to accept it, because, oh man, people are getting older. What can you do? You can't get angry at that. You can't want to hold that to account. And so therefore, implicitly, if you accept the definition of the problems, you are accepting the solutions, which are the corporate solutions. And it's basically about extracting profitable services from hospitals and largely discarding the rest. Yes. So people remember possibly the polyclinics. George Monbiot wrote intelligently about those, and they were closing down. They were behind the closure of both hospitals and GP services. It's about restructuring the entire service, not based on need, but based on profit. And to do that, you have to spin what you're doing as being based on need. So we have this narrative about changing needs, that the aging population, basically the implicit thing is old people don't need to have a local hospital. They don't need to have a local GP with an actual doctor. That's what it kind of implies in practice. But it's not being done according to the needs of supposedly changing needs of the people. It's being done according to corporate requirements. Go on, yeah, cut me off.
When they talk about not having, we've got to have more hospitals have to be broken up, and we have to have things in smaller clinics and stuff.
Yeah.
Is that easier for private outsourcing than if they're in their own little buildings with their own clinics? Is that the whole thing when they say we can't have these centralized hospitals because they're not good for us? Is that what they're doing?
Yes, because you choose it's a general hospital. That means it does everything pretty much. Broadly, that's what it means. It means you had everything on your doorstep. Yes. perversely the whole narrative about taking away your local hospital, the local district general hospital. And this is a phrase very much associated with Darzi that we'll see in one of the clips that we have, that he was bringing the district general hospital to an end. David Cameron milked that to the full, pretended to defend the service. He won in 2010 on a ticket of stopping the kind of destruction being wrought by people like Darzi. Quoting Darzi himself, his line, "No more top-down reorganizations," was a direct reference to the destruction of the National Health Service happening under New Labour. And that's why we have to remember they were destroying the service. The narrative that good Labour funding, bad Tory underfunding, serves to cover up all the politics of that. So yes, to answer your question directly, in case I haven't, it's the select profitable services that are taken out and put into, diagnostics. We've got urgent care centres, which are minor injuries. They're not proper A&Es, and they're designed to be. They can be in shopping malls. They don't have to be in hospitals. The King's Fund is a bit upset that they're still in hospitals, but they're extracting just the profitable bits and getting rid of the comprehensive care that we had locally, which is the definition of the NHS, the general practice to general hospital, everything locally on your doorstep. That's what New Labour was destroying. People have to remember that. That's also what happened under the Tories. It happened under people like Darzi, under New Labour, and under the Tories. And we're getting a sort of reconfirmation that that's the correct thing to do, that we haven't done enough of it, and that it's driven by all these sort of changes.
Right. So what would you like to? You've got a couple of clips of
yeah.
Him. What would you? Should I play one of them? You can explain.
Play one of them, but first I think Caroline Malloy of Open Democracy was sharing this recently, and it's key. I mean, I agree that the book, The Plot Against the NHS, I mean, that is the key book to understand. It's from 2011. It's about how New Labour attacked the health service. It's a real eye opener. There's an article that kind of summarizes it of the same title. And I'll just read this extract because it's totally relevant. You can't really understand what the Tories did without understanding what New Labour did, because it's the same thing and often run by the same people. So I'm going to quote from the book, to solve the persisting difficulty of building up a private healthcare industry, that was the problem that they were posing themselves in the Department of Health. It estimated that about 60% of hospital work, all the outpatient clinics, much diagnostics, most minor surgery could be unbundled from the rest of hospital activity, shifted to these new Darzi centres, but there's variations on it, and it's the same process happening today, presented about bringing health and social care together. All that narrative is part of this, and which will be built and operated by the private sector. This aspect was not mentioned by ministers in public. The official view was the shift was aimed at improving patient care. That's the constant. Streeting saying this is about bringing down waiting lists, but he's actually talking about the policies that are bringing up the waiting lists. It's spin. So we have to be able to cut through. In private meetings held with the private sector every 6 weeks, I'm still reading throughout 2011, 2007 and 8, it was made clear the new centres were to be an opportunity for private investors. That has been the policy to date. The man chosen for the public exercise was Sir Lord Darzi, who was often pictured in his operating theatre scrubs, lending the project an aura of high-tech professional dedication. Again, he talks about himself being a humble clinician in the House of Lords. It's all presented as a clinical thing that you can't quite understand. None of us are born knowing what benefits the private sector. It's something that you learn. None of us on the left, probably are really tend to want to be interested in that kind of thing for its own sake, but it's about knowing our enemy. So yes, destroying those hospitals. Happened to see that you were involved in the campaign to defend the Charing Cross Hospital, Crispin.
Yeah,
this was under Jeremy Hunt, right? And it's the same policy. They were going to, if I remember correctly offhand, they were going to be downgrading a number of A&Es to minor injuries, to urgent care centres.
Yeah,
that's a US model. It's a business model. They're being systematically outsourced to totally PLC because it's the restructuring stupid. I'm just quoting that Hillary Clinton. It's the economy stupid. I'm not calling anyone stupid because nobody has to know this by birth, but it's about the restructuring. It was and remains about going away from something that was structured to serve people, where you had everything, to something that's only got what benefits profit. We've got a few more minutes.
Yeah, do you want me to play the clips?
I could. in a second. How about in a second? No, okay. Play the one. Can you play the one of the one that hasn't got David Cameron? Do you know which one that is?
Yeah.
Yeah, that one. It's just the language that we hear from a Darzi. It's the same stuff. And
this is Darzi himself in his own words.
The incentives aren't aligned in any way to achieve that integration. I think what's missing here is what I described, the business model innovation, the creative business models that will bring in the different providers across that pathway of care to work together. Saying that though, if you look at around the NHS, across the NHS has remained in the 20th century in the levels of convenience and customer services it provides.
Are there things that you've seen internationally that could help? You know, examples you've seen or heard about that you think we perhaps ought to be taking more notice of as we move forward?
I mean, many people say integrated care providers like Kaiser and others, the HMOs, are the way forward. And definitely they are.
Okay. So just a little bit unpicking. Or do you want to try? Do you want to go for it?
No. It just sounds really sinister. All the language he's using and the business models and everything, it just doesn't sound optimistic to me what he's going to do. It's
atrocious, but it's the language of health policy in the UK. It's the language across all parties. It has been that way. You cannot. It's such a soul tormenting thing to just look at those videos and try and pick out bits that are worth hearing, because it's just odious language. It's really horrible. It's framed as neutral, like there's no question. Nobody's saying this is about business over people, or there's things that are carefully avoided, talking about closures as closures. But we're looking forward to more closures. And I think that's worth stressing, particularly hospital closures. But because it's been the trend up till now. It's not a new thing. None of it, there will be variations, but the trend is the same that we've had to date. And the model that she's asking him, is there anything that you can think of abroad? I don't know. Maybe that's the model that has been copied, right? That's the model that Fletcher started copying. What's called GP fund holding. You are giving people who are supposed to be working inside government healthcare provision. It's not really an NHS, but within that, you are framing what they do within business thinking. And to understand what that means, you just have to think of what a private company does when it takes over a local service, an ambulance service. I mean, what would you say is the damage? Why does a private company damage a local service when it takes over? What would you?
Because it wants profit, really. That's it.
Yeah, but what does it do to get profit? You might not say what.
Cuts staff. Yeah.
Cuts corners, if I can put words in your mouth in a brutal way. But that we kind of understand that that's what a company does because it's a company. Now that's what it does when it has a contract. The same thing it does when it influences national policy. It's the same policies. It's about cutting corners nationally, and you get all these narratives: we don't have money, or we've put in a lot of money, therefore we need to be more efficient. But you get the same corner cutting.
Can I just come in, because there's a question I don't really get. If Greeting's saying there's all these long waiting lists, and in say a few years the waiting lists are longer, which you seem to be suggesting it would be, how can he save face? Is it going to be a case of him changing the definition of a waiting list? Is that the kind of thing they do, that he kind of make out that they've been seen, but they haven't actually been I'm not treated or something like that?
I can't. I'm going to say what I know and what I don't know. I can't say, waiting lists. He may say the reason the waiting lists are created and by reducing the provision of services. So that reduction is continuing. Labour throughout. I mean, in the Labour Party, we were trying to get the shadow health teams to oppose the policies that are cutting hospitals, that are replacing real doctors with fake. It's not streeting. This isn't streeting, and it isn't Darzi. It's Labour, and it is even not just Labour. It's institutional in the main parties. It's basically corporate. So I'm not, waiting lists under Blair. They managed to have, waiting lists go down, and have certain good results in the short term that left an image of what New Labour did that enabled it to install the permanent long-term damage that we're seeing today. So I won't predict that, but they will definitely keep reducing the services. I mean, because that's what they've been supporting until now. That Wes Streeting supports, for example, it says Labour supports the workforce plan that's replacing real doctors with fake. So I'm not going to put anything past them.
I mean, there could be, I mean, the waiting list could go down because people don't bother to ask for treatment anymore. I mean, that could be another way that they could go down. I mean, they've got to spin it that he's done some good, or otherwise, yes. But that's the whole thing. I mean, God knows how they're going to spin it.
Well, we've seen, and one way of spinning is by taking attention away from the policies reducing the service and blaming external factors, blaming the age of people, so-called demand. That's a complete market concept. It's not needs anymore; it's demand. So I mean, spin is part and parcel of destroying the service. You can't do it without spin, but that might vary. But what's continuing is the reduction to business models that like what Darzi was talking about. We have institutionalized a system where these bodies their function is to cut back services in this way and be rewarded for doing so and punished financially for not doing so. So there are things we can't predict, but I can't predict. But there's a direction that we're still in, and fundamental to that is that the reason for creating the health service, the reason for nationalizing, is that only the state was able to provide all the services, regardless of whether they're profitable to provide or not. And by going away from that, we are left with companies that only want to provide certain services, and we end up. You talked about centralization. We end up with major trauma centers that are really far away. We don't all have a local A&E anymore. We don't all have the general hospital and locally anymore that we can actually access. But we have those services are minimalized and sent further away. I think that's the key to it. Is the reduction, the ongoing reduction.
Right. And I mean, we'll need to catch up on this because he said he's going to do a very quick investigation into this. I bet he's already done.
Yeah, I mean they can just copy and paste what they've already got. It's the same stuff we're always hearing. We need more care in the community. When Streeting says it's more money for GPs, it means less money, fewer hospitals. It's all the same. It's the same spin about hospital, about what you saw in Charing Cross and what Corbyn's seeing in the Whittington under New Labour and under the Tories. Same policy, same people. Is about that. It's about reducing that. But we have time for the Cameron clip? Because if I can summarize it,
and then sure.
It's Cameron milking New Labour's destruction of the service in Darzi's own words, and then what was left out of the debate, the fact that they were copying the US and basically profit-based structures.
What the last government did was they had top-down plans to shut hospitals. They actually said the days of the district general hospital are over.
I said in my London report, the days of the district general hospital seeking to provide all services to a high enough standard are over. For reasons that are beyond me as a humble clinician, most of that sentence is removed when it's quoted.
Yeah, so he's saying like that it's fine that we're getting rid of them as general hospitals. He's saying downgrades. It's all right. It's just a downgrade. It's no longer a general hospital that provides everything to a good standard. It just does less, and you can go further to get certain treatments. But the point about that is he quotes the US model, the example of US government policy at least 4 times in his review. Here, the numbers of specialist hospitals in the US have doubled in the last 20 years. We expect to see a similar trend in England. That is the background for it, and it's not because it's done for the benefit of the public. It's part of a system that's built to enable a large dominant private healthcare service system at the expense of people having the care they need that they can access.